Yes, good morning, Sade. Mental health obviously such a big topic, and Governor Greg Abbott has just recently announced more than $200 million in grants going towards mental health care in rural communities. But I was able to speak to some local facilities here in some of our neighborhoods, just like the Heart of Texas Behavioral Health Network here behind me, and they tell me it's something that could have a big impact both locally and across the entire state. Governor Greg Abbott recently announced $239 million in grants for mental health care in rural areas throughout the state. The goal is for the Texas Health and Human Services Commission to focus on helping treat and stabilize patients in rural communities without having to drive to a major city.
But we have a lot of behavioral health need in our state.
Although the money won't be going towards hospitals in Central Texas, local mental health facilities tell me it's something that is beneficial for the entire state.
Helping any of the state hospital capacity issues that we encounter on a day-to-day basis can affect and positively impact what we're doing here. It is always a challenge to find hospital space in the state for a lot of the individuals we serve.
Sharing that finding mental health services throughout the state can sometimes be a challenge.
We definitely deal with an awful lot of individuals who've had difficulty finding appropriate services, whether that be outpatient or inpatient hospital services.
Funding will go directly towards 332 beds for mental health patients across 4 communities. According to the Heart of Texas Behavioral Health Network, as of the beginning of this year, there are a total of 1,753 individuals in Texas county jails awaiting a hospital bed. Locally, there are currently 32 people in the McLennan County Jail awaiting a bed. 11 are awaiting a bed in a maximum security unit, while 21 are in need of a bed in a non-maximum security unit.
We're an underfunded system nationally, and that holds true within the state too.
Local facilities tell me they're glad to see much needed progress being made.
So we appreciate all of the assistance we can get from the legislature and the governor's office.
The grant contracts are currently in various phases of design and document development. Back to you, Sade.